Εξοχότατη κυρία Πρόεδρε της Ελληνικής Δημοκρατίας, κύριε Πρόεδρε και μέλη του Διοικητικού Συμβουλίου του Delphi Forum, κυρίες και κύριοι, ladies and gentlemen, I am truly delighted to join this first day of the 2020 Delphi Economic Forum and be part of the discussion on a theme that could not have been more timely this year, the discussion on the day after Covid-19. If I may be allowed, I would like to start with some personal reflections. When we took over the portfolio as European Commissioner for Health and Safety, we could never have imagined that 1 month after taking office, we would be dealing with the greatest global pandemic in recent memory. A public health crisis of unimaginable proportions. Hundreds and thousands of lives have been lost. Families have been separated. Economies shut down and plunged violently into recession. The COVID-19 pandemic has undoubtedly illustrated very clearly the link between health and of our societies and our economy. What started as a healthcare crisis may have a recession of the global economy as one of its likely fallouts. I want to begin by stressing this important point. We cannot safely exit from the economic crisis until we first end the health crisis. The question then is, how do we do this? Since day one of this pandemic, it was clear to me that collaboration and solidarity is the only way forward towards a healthier, more equal, and more resilient communities. In practice, this means that healthcare cannot be the responsibility of the healthcare sector alone. Our transport and energy sectors, urban planning, trade and education, as well as our agricultural sector must all become part of the solution. This applies to the current crisis, but also to the day after COVID-19. And that solution must include the most vulnerable members of our society. They are the baseline by which we must measure success. So I consider it very important that this year again, the Delphi Economic Forum gathers experts in the fields of sustainability, politics, academia, healthcare, human rights, and innovation. This is exactly what type of coalition we need to have in order to make a long-lasting progress. Viruses target and amplify the weak points of any society. In this case, our resilience to crisis, health inequalities, gaps in our supply chains, and the rise of non-communicable diseases. COVID-19 put unprecedented and sustained pressure on our hospitals, on our frontline workers, and our supply of medicines and essential medical equipment. However, while this is a time of crisis, it is also a time of opportunity to reflect and to become wiser on our past, our present, and our future actions, on the way forward without losing sight of yesterday's lessons. The pandemic has shone a light on many areas we need to focus on and strengthen. It has given us a chance to build more robust systems for a sustainable future. And it has given us a wake-up call. We need to act, and we need to act now. Allow me to touch on 4 areas of particular importance. Firstly, on exiting confinement and restarting our economies. Citizens across the EU have made unbelievable sacrifices in recent months. Now, they deserve a break, a breath of fresh air, a chance to travel, to see relatives and friends. However, we also have a duty to ensure that they can do this safely, for themselves as well as for the public at large. I will never get tired of repeating that the pandemic is not over. The virus is with us. Public health is and must continue to be our main priority. We should not allow the easing of restrictions to jeopardize what we have achieved so far. And that means that the gradual resumption of travel and tourism should be accompanied by vigilance and rigorous health security measures. Solidarity, close coordination, and cooperation have guided our response to COVID-19 since the very beginning of this pandemic. Now, they must underpin our efforts to go back to a new normality when we learn to live with the virus. With this in mind, we presented a package of guidelines on 13th of May, focusing on internal borders, on transport and tourism establishments to help member states to gradually lift travel restrictions and allow tourism businesses to open while respecting the necessary health precautions. In the response to this pandemic, Greece has followed a clear, science-based approach, took immediate and decisive action, and prioritized testing. I believe the results speak for themselves, and the Greek people, every single citizen, as well as the government of Prime Minister Mitsotakis, can be proud of them. I urge Greece to continue with this approach during the summer months and beyond, and the Greek citizens to continue demonstrating an exemplary sense of responsibility as they have throughout this crisis. The second area of fundamental importance is about the next steps of our response. The real exit strategy from the crisis is one, the strategy to get a vaccine. We have mobilized all our means to help member states to tackle the coronavirus pandemic, but we all know that unless we find a vaccine, we will not be safe. The vaccine needs to be accessible to everyone, fairly and equitably. A vaccine for Europe, a vaccine for the rest of the world. An efficient and universally accepted vaccine is what will truly make a difference in our efforts after COVID-19. The quick and successful development of a potential vaccine depends primarily on our forces to join and work together. This is why I have been consulting with member states and the pharmaceutical industry on a very regular basis since the beginning of this crisis. And this is why together with our global partners, we launched a global pledging marathon at the beginning of May, which has so far reached over 9.8 billion euro in pledges worldwide. Just last week, we pledged another 300 million euro to Gavi, the Global Vaccine Alliance, to help immunize 300 million children around the world and finance vaccine stockpiles to shield against outbreaks of infectious diseases. In parallel, we have mobilized 75 million euro together with the European Investment Bank to support CureVac, a highly innovative European vaccine developer. As soon as next week, there may be more news coming from the Commission in terms of a groundbreaking vaccines strategy. The day after COVID-19 will also depend on our ability to protect the most vulnerable in our societies. The European Centre for Disease Prevention and Control is collecting best practices in COVID-19 for homeless people, for disabled people, and those with mental health issues. ECDC is also providing essential guidance in COVID-19 for residential care homes, prisons, and migrant communities. Of course, I recognize that Greece is under immense pressure when it comes to the issue of refugees and migrants, many of whom find themselves in a desperate situation. In March, we provided 700 million euro to help Greece respond to this pressure. We also launched the Civil Protection Mechanism based on a request from Greece. Through this, Greece can receive assistance in terms of medical equipment and expertise, shelters, tents, blankets when needed. But here again, the game changer will be the vaccine. And that is why it needs to be and is the foundation of our work for the day after. The third essential element is how we deal with health from now on. Do we need to shift the paradigm in terms of health policy in the European Union? And above all, this virus has taught us that Europe needs more in the area of health and public health. We need to give health a priority. The instinctive reaction of our citizens at the beginning of the crisis was to ask, where is the EU? This is a natural question because the EU citizens expect the EU to have an active role on such a fundamental issue in their daily lives. This is a call we heard loud and clear. Ladies and gentlemen, we need more Europe in the area of public health. We urgently need to invest in health and social care. And this is precisely why, as part of our response, we have proposed an ambitious standalone health programme, EU for Health, for the 2021-2027 period. It comes with a proposed budget of 9.4 billion euro. This is 23 times larger than what it was until now. But this is not just about money. This is about massively scaling up our resources available for combating cross-border health threats, creating EU stockpiles of medicines, protective equipment, and ventilators for when the need arises, having teams of flying doctors ready to be dispatched to member states, and improving access to healthcare. It is about promising and promoting health promotion, disease prevention, and improving access. It is about addressing health inequalities wherever they exist and the burden from non-communicable diseases such as cancer, for which, at the end of this year, I will be proposing an ambitious EU strategy, the Europe's Beating Cancer Plan. The fourth element of the day after is a sustainable future. COVID-19 only brought into sharper focus questions about sustainability, green development, the circular economy, and the reimagining of the crisis, our energy sources and our food systems. I am delighted to see that many of these topics will be addressed in this year's Delphi Forum, and I do hope I will be able to be with you in future fora. The Farm to Fork strategy, which is at the heart of the European Green Deal, will help to deliver our ambition for healthier societies and a healthier environment. Adopted just over 2 weeks ago, it is our long-term strategic vision to transform the way we produce, distribute, and consume our food. In parallel, there will be measures to promote healthy diets, healthier lifestyles, and actions to address food loss, food waste, and animal welfare. I believe it is a vital step towards a healthy, fair, and eco-friendly food system, and one that meets citizens' expectations. Ladies and gentlemen, the COVID-19 pandemic may have undermined and underlined some of our weaknesses which we are already working to address. But we need to address them not only in the short term, but also in the long term. The COVID-19 pandemic, however, has also highlighted our strengths: solidarity, compassion, and partnership. Neighbors, communities have come together providing support when it was needed. Citizens clapping on their balconies across Europe to support care workers every evening at 8 p.m. We owe immense gratitude to all our medical and frontline workers for their prolonged efforts. I want to take this opportunity to thank member states, industry, civil society for their coordination and collaboration in the recent months. This pandemic has reminded us of the values of working together, the importance of taking bold steps to tackle common challenges in the area of health, of standing side by side as citizens and as member states. We have a long way to go, but we are on the right path. We are determined to work with all the means possible to bring about positive change. I know, and we all know, that this is not going to be an easy challenge, and this will be for the rest of my mandate. But I am determined that we will succeed. Thank you. And once again, I want to thank you for inviting me to address this important forum, and I wish you a productive week of discussion, debate, and learning, and really look very much forward to being able to be with you in the future. Σας ευχαριστώ πάρα πολύ για αυτή την ευκαιρία. Σας ευχαριστώ.